one more story for you, and this might be of great significance and importance to all those that are aspiring to be those, extremely fit people, because that's the new trend and in thing these days. Because when we think of heart disease, we usually think of age, we think of obesity, diabetes, maybe chain smoking. We rarely imagine it striking someone at the absolute peak of their physical fitness. Yet, every few years, the sporting world is left stunned. An elite footballer, someone who trains every day, runs over 10 kilometers in a single match and represents the very definition of athletic excellence, suddenly collapses because of a cardiac emergency. We've got some of those cases in front of you. Marc-Vivien, Fabrice Muamba, Christian Eriksen very recently, Tom Lockyer. Some survived, some tragically did not survive. And these moments have changed sports and the sporting medicine forever. But they've also raised a much larger question, especially on Doctor's Day. Can the pursuit of extreme fitness sometimes place extraordinary demands on our little hearts? Or is the real danger something that remains hidden until the body is pushed to its absolute limits, even for those professional athletes? And that's exactly what renowned cardiac surgeon Dr. Devi Shetty has been speaking about, exclusively warning us here on News9. Listen in to that reaction first.
I want you to Google FIFA, FIF, Federation of Football Association, then you write cardiac arrest. Then you get series of articles which is published from the FIFA experience. In the last 4 years, 670 professional footballers had a cardiac arrest during practice session. In just 4 years, this is what is documented. Undocumented cardiac arrest will be 10 times more. I want you to tell me who is fitter than a 20-year-old professional footballer. So if you are very confident about your health and your fitness, I just want you to read the article. Then you realize that how fit you feel has nothing to do with how fit you are.
An important perspective there from Dr. Devi Shetty. Now, it's equally important to separate science from sensationalism. There is no credible evidence that elite football is witnessing a sudden epidemic of heart problems. But what doctors do know is that some athletes unknowingly carry silent genetic or electrical heart conditions that may remain completely undetected until intense physical exertion brings them to the surface. You've got extreme training that changes the heart. It becomes larger, it becomes stronger, it becomes more efficient. For almost every athlete, that's a healthy adaptation. But in a very small number of cases, hidden heart disorders can make extreme exertion dangerous. That's exactly what we're going to be discussing right now with Dr. Professor Tarun Kumar, senior cardiologist, with us on the broadcast. Doctor, what's your assessment here? What do you make of this entire segment that we've put up? Today's culture of glorifying extreme fitness, is that come as a boon or as a bane? Without enough emphasis on heart health, people step out to do that high intensity, interval training, becoming athlete-like without really going through the science that an athlete has to go through, the supervision of it all?
See, one thing is physically fit is not synonymous with your medical fitness. And this training part, it should be gradual over a period of time so that your heart and your body can adapt to your high, initially light, then moderate, then high intensity training. Because sometimes what happens if you are not like underwent any medical examination, there are two kind of problem which can happen. One is cardiomyopathy, which is very much common, like hypertrophic cardiomyopathy.
Yeah.
Patient may be fine at certain age of time. It can develop later on because it is genetically determined disease. It can develop in adulthood any period of time. So regular screening is required. Somebody may be fit at 20, he start developing this HCM in next 5 years or so if it's genetically predisposed. And second thing is heart attack because of coronary artery disease. Sometimes even 6 months of your hayward eating lot of stuff. So this small plaque can deposit. It's not like patient will having 90% of plaque burden.
Yeah.
Some 10-20% plaque can build up for even for your irregular lifestyle for few months also. And these plaques, if they are very if you underwent some intense training suddenly and uncontrolled diabetes, uncontrolled hypertension, stress, all these factors can lead to this plaque to rupture. And body has a tendency to heal whatever things happen. So whenever plaque ruptures, the body has a tendency to form clot at that point of time, at that site also. And this can lead to acute heart attack. So it's not like if some person is having significant coronary artery disease even small plaque, which like 10%, 5%, 20%, they have tendency to rupture. And these can rupture depending on the different circumstances as I enumerated. Like,
But then, doctor, look at what Dr. Devi Shetty said. Did you listen to what Dr. Devi Shetty said? He says about, FIFA players, these are athletes, they're used to running 10 kilometers every day. When something this significant happens to them, I mean, someone that appears absolutely fit on the outside can still be carrying a silent cardiac condition. So for those, how do we understand that? Is there some sort of scanning or imaging that needs to be done?
yeah, yeah. One thing is like family history. If there is a family history of sudden cardiac death in the family, and then we should be vigilant. If genetic testing has been done, if patient is having genetic history or family history of hypertrophic cardiomyopathy, so their screening start by 18 years of age. Initial echo assessment can be done. Then if normal, then every 3 years, 5 years, echo assessment should be done. If you feel ki okay, this is hypertrophic cardiomyopathy initial stage, then very frequently, and these person we ask them not to participate in any heavy exertional sports, because this condition can, there are two things. It can cause dynamic obstruction, especially which can happen with exertion, or there is a tendency for increasing heart rate, which we will call electrical irritability or instability. So this electrical instability can lead to your problems, like it can lead to
in today's time, doctor, in the current day and age where we're looking at more diabetes, more obesity, more heart diseases, more young people getting diagnosed with cancer, routine cardiac screening, should this now become common, not just for professionals or athletes out there, but for everybody? Is that the way we're headed?
Yes, because this screening is must. And now, like previously, we used to say, okay, you are 35, now you start getting yourself screened for cardiac problem. But now we advise by 18 years of age, get your all these numbers checked.
What all tests are you talking about here, doctor? Let's lay it threadbare for the viewers.
See, first thing, like your lifestyle should be well in your teenage group, like in school, so that you don't have any problems in your adulthood.
Yeah.
And once you become 18 years of age, if you are even healthy, then get your blood sugar level, your blood pressure, your lipid level, and once in lifetime lipoprotein A assessment. And if you are planning to participate in any heavy sports or any gym you want to underwent or gym training, so get your ECG, echo, and TMT test done. Even coronary artery calcium score can be done in selected patients, in which patient is this assessment is required.
Okay. I've got two more questions for you, doctor. First and foremost, and you may exercise brevity, we're running out of time here. Elite athletes, are they more likely to discover some underlying heart disorder simply because they push their bodies to the limit? For the common man out there, they're not really pushing their body to the limit, so it's unlikely that they'll figure out some underlying heart disease.
No, it's not like that. In like general population also, if you find like they may be very much undetected diabetes, hypertension, heart problem, but they don't exact to that level at that level, so that their condition become very unstable and they have plaque rupture and heart attack. These elite person, they sometimes take unnecessary supplements. So this may be an issue, and sometimes you can see like effects of smoking, drugs, and this unnecessary supplement can add risk to these elite athletes.
Okay. And my final question, doctor, because you see, you're the right person to be asking this. There needs to be a line that one has to draw. Where is that line between what is called as healthy fitness and relentless performance obsession and extreme fitness?
See, one need to be very much fit so that he can able to carry out a day-to-day activity depending what his profession, occupation, and need. And you need to understand the demands of your body. Also need to listen to your heart, because you will get some like warning signals. Like recently I operated one case of who had cardiac arrest in the gym. He was having left arm pain on heavy exercise, but he was neglecting, always saying it's muscle pull. So if you start listening to the small like symptoms he's producing and get yours properly checked, then maybe that instances of cardiac arrest in the gym or may not arise.
Understood.
And fitness is the right mantra, so that you can go ahead physically fit in your life and get yourself checked not once. It is a repeated assessment, because what I told you, these genetically conditions, they may not appear by 18 years of age. They can come at 25, 30, 35. So that you should get regular screening if you have a family history of sudden cardiac
Listen
death.
to your heart. I think that's the most operative part here. Many thanks, Dr. Tarun Kumar, because you see, fitness it does save lives, exercise does help, but pushing the body beyond the limit might actually be creating the problem. Beyond the limit, it can sometimes put the heart at risk. And knowing that difference, knowing when to listen to your heart, may be the fittest decision one can take in their lifetimes. Many thanks, doctor, for taking on the time and speaking to us here